Okay, so good evening to everyone, and thank you for joining the webinar. So look, the webinar is mostly it's a interactive session, and before start, I think I have talked with everyone. Ekta, I have talked, Shiny also, Madia and Afroz. I just send me a message on my WhatsApp that you have joined. Okay, and let me give my background. My name is short name is Dr. Joy. You can talk with me in Dr. You can address me as Dr. Joy. My full name is Dr. Jyoti Majumdar. One second, somebody is joining now. Okay. So basically, my background is I'm a doctor, medical doctor. I did my MBBS and I did my MD, Doctorate of Medicine. After that, I saw a lot of diseases which are happening in the world, starting from cholesterol or diabetes or let's say fatty liver. All diseases cannot be cured only with the help of medicine. Okay, that's why it triggered me to do research, and I went to US to do my research work in Ph.D. in nutrition and medical dietetics. I think somebody has joined now, Vivetika. Can you hear me, Vivetika? Am I audible to you? Yes,
Yes, sir.
Vivetika, you are a MA
Yes, sir.
graduate, yes? I remember.
Yeah,
Yeah, so you wanted to learn nutrition for your own health or to earn money? What is your goal?
so I just want to earn some money for too and for
Okay.
my health conditions.
Okay, sure. So just send me a message on my WhatsApp. Just write, I have joined. Okay. On my WhatsApp, you have got
Sure,
the
sir.
WhatsApp number. And our
Sure, sure.
Afroza, Zeva, Madiha, Ekta, Saini, everyone send me a message. Okay. We have just started. You have joined 1 minute before you have started. Okay. So I was just telling that after doing my MD doctorate, I went to US to do my nutrition medical dietetics research. And a lot of diseases which I found that not a single medicine can cure any disease fully. There are many examples are there, like cholesterol, like fatty liver, like diabetes. You have to change your lifestyle, then only you will get a proper results. Otherwise, in all my students are able to reverse diabetes type 2. But how to reverse diabetes type 2? For that, you have to learn what is the meaning of insulin resistance. I don't know if somebody has heard about it or not, but we'll discuss about it today. Secondly, after that, I came to India in Bangalore. Then I got an opportunity to do my research work on cancer diets. So at present, I'm doing my research on cancer diets, and mostly in London, I live or Dubai, and also in Bangalore. But I have got students all over India, starting around 300 students are there, and also outside of India, also I have got students. Um, what is the necessity of the nutrition and dietetics has become so high now? As I told you that I'll give you some examples. You will see why only by taking medicine you cannot cure all the diseases. For example, everybody has heard about LDL. What is the meaning of LDL? LDL, everybody has heard about LDL cholesterol, yes or no? Vivedika, you
Yes,
heard about LDL? Ekta, what is the meaning of LDL full form? Do you know? LDL. It is low
low
density,
cholesterol,
yeah, lipoproteins. But there is another
lipoproteins.
thing which is called bullet LDL. Did you heard about bullet LDL? Bullet LDL. Bullet means like bullet in the gun. Bullet LDL.
No, sir.
This is a new type of LDL. Okay, so today you will learn mostly the around new things which is not in Google also. These are new research work. Okay, that's why you are joining here. That's why a lot of doctors, dietitians, after finishing MSc, PhD, they comes to do my PG courses, certification courses. Bullet LDLs are the latest they discovered LDLs which are very smaller in size. When cholesterol means it's a fat, okay, combines together with glucose. What is glucose? Glucose is coming from everywhere, from rice, chapati, everywhere glucose, sugar is there. So when cholesterol it is combines with glucose, it becomes a very oxidized LDL called bullet LDL. So this bullet LDL cannot be reduced by any medication. So when you take medicine, mostly what you are taking medicine, statins, like atorvastatin. These drugs are the largest selling drugs in the world because most people die in the world of the cardiovascular heart attacks and cardiovascular diseases. So pharma company are making medicines and we are taking it. But is these medicines are working? If I tell you the largest selling drugs in the world, medicine in the world is Lipitor. It's a Pfizer company from USA. Their medicine is selling around $40 billion per month. It is maybe in the world it is sold hundreds of billions of dollars in a year. But Why heart attacks are happening? If statins can clear up the arteries, means nobody will die of heart attacks. But heart attacks are happening in 1 minute in India. 10 heart attacks are happening. So you can understand so many heart attacks are in month maybe 4 lakhs. And people, the most lethal cause of the death is heart attack. The answer is these statins cannot reduce the bullet LDL and triglycerides, which are the main cause of the heart attacks. They are reducing the other LDLs like fluffy LDLs, which are not harmful. They are not harmful. So that's why you can understand by taking only medicine pills, you cannot get rid, you cannot win the diseases. So that's why even cardiologists are giving recommendation to do a lifestyle change. There are many examples are there. For example, I'll tell you diabetes type 2. There are many types of diabetes out there. Diabetes type 1, type 2 and 1.5. Three types of diabetes. Type 1, if anyone has heard about type 1 and diabetes type 2, but diabetes 1.5 is a new diabetes. That also I'll tell you today. In diabetes type 2, which is 80% of the patients are suffering from 85% are diabetes type 2. And diabetes type 2 can be fully cured. By medicine, you cannot cure it. If you take medicine like metformin, you will see that the doses will increase 500 from 1000 to 2000. A lot of people are telling I am taking diabetes medicine and my diabetes is in control. The answer is it's a myth. Sugar can be controlled for temporary period, but again tomorrow it will go high. You have to take medicine whole life. It's a very old, it's a old it's a very old myth that only by taking medicine you can cure diabetes. After some time, your metformin medicine will not work. You have to take insulin injection. After that, kidney failure, and what happens? Kidney transplantation. Otherwise, you go for dialysis. Otherwise, early, fatal conditions are there. But all my students are able to reverse diabetes type 2. But how? With the lifestyle change. Okay. So that's why you will see that only by taking medicine, you cannot cure 100% any diseases fully. If you take a proper diet, you will see that medicines are not needed. So all these diseases are coming from the lifestyle. Okay. So let me present also. Okay. Everybody can see the presentation. Yes. Okay. First of all, what are the courses or what are the training programs are there? There are two courses are there. Basic course is for the beginners. If you have no idea about nutrition and dietetics, the fundamental course. The advanced course is for the who have already got some knowledge about nutrition and dietetics. You are a MSc, BSc, then you can learn the advanced course also. Okay. What is the reason that the nutrition and dietetics has got so high demand? Because India has got 85 crores of overweight people. It is one of the second largest after USA, and we have exceeded China also. Now, if you see the diabetic condition is happening in India it is rapid growth 120%, 109%. It is one of the 3%, 3% have a potential to become diabetes. Also, insulin resistance are having in India around 88%. But what is the meaning of insulin resistance? Anyone has heard about it? Ekta, did you heard about insulin resistance? Madiha, Afroz, anyone has heard about insulin resistance? No? No one has
Yes, sir,
heard.
I have heard.
But can you tell what is the meaning of insulin resistance? What is this? Difficult to tell.
Yes, sir, actually.
Yeah, insulin resistance means the insulin level goes very, very high. Okay. It happens in the diabetes type 2. More insulin. In diabetes type 1, there is no insulin. Okay. In diabetes type 2, there is a lot of insulin is there in our body. And the body cell receptor will not respond to insulin. Okay. And what
Yes.
happens? Sugar levels are in the blood. Sugar levels are sugar in the blood. It cannot come inside the body cell because body cell will not respond. It cannot get inside the cells. The sugar is in the outside. I will explain also what is the meaning of insulin resistance, because if you know the concept of insulin resistance, then you will be able to reverse diabetes type 2, fatty liver, PCOD, thyroid, many diseases you will be able to reverse. Okay, so that's why insulin resistance is very important. In the basic course, mostly you are learning about the basics of nutrition and dietetics. There are some fundamental things in nutrition and dietetics are like glycemic index. Okay, insulin index. In glycemic index, did you heard about it? No one has heard about it. What is glycemic index? Glycemic index means what? Means what food you are taking, how fast it will convert into glucose or sugar. Like glycemic index of rice is 86, very high. Glycemic index of bread. Glycemic index of bread is 100, means when you eat bread or idli, dosa, rice, it will immediately convert into glucose. Glucose is not a sugar what you add in your tea. Don't get confused. Glucose is a type of sugar which is not sweet. Okay. I think somebody has joined now.
Yes.
Sai. Yeah, Sai, can you unmute yourself and just tell me what is your full name? Because I don't have anyone with the name of the Sai today. Or somebody has given you this link to you. Because or maybe your name is different. What is your correct name? Sai, can you tell me? Otherwise, I have to remove you in 5 minutes, okay? I don't know who are you, from where you got my number, or from where you got my details about these meetings. You are like a ghost. Don't become a ghost, okay? So just otherwise send me a message on my Telegram. Sorry, on my WhatsApp. Otherwise, in 5 minutes you will be out. I don't want people who I don't know. Okay. Sai, you are aware of it, yes? I'm talking to you. Either talk with me, otherwise you have to go from here. So what is the meaning of the glycemic index? I told the food what you are eating is converted into glucose. Okay. So that's the meaning of the this one, glycemic index. But what is the meaning of insulin index? Anyone knows insulin index? What is the meaning of insulin index?
So,
Anyone knows? No? No one has heard?
no, sir. Insulin.
Okay. But everybody knows what is the meaning of insulin?
Yes,
What is
sir.
insulin? Insulin is what, Ekta? Just tell me, what is insulin?
Sir, insulin who that neutralize the effect of glucose.
Yeah,
I
it
mean,
is a
in
hormone.
body, yeah,
Insulin
it's a
is a
hormone.
carrier. It's a carrier. Okay, it comes and it will take the glucose from your blood. Okay,
Yes,
so
sir.
that is what it is, reducing the level of glucose. Okay, somebody has joined. Samina Sultana. Samina Sultana, it's your real name. I don't have anyone with Samina Sultana. Very strange. Today, a lot of people are joining. I don't know from where. Who are you, Samina Sultana? Do you have my WhatsApp number? Who gave you my number? In 5 minutes, if you don't tell your identity, I have to remove you. I don't know who are you. Okay, please unmute yourself or write me who are you and what is your WhatsApp number. I don't know from where people are joining today. I have no idea. I don't have your number, name. Name is different, like a ghost. I hope you are not a ghost. Samina and two people that joined from where I don't know. Sai. Sai, who are you? Send me your number here. Who are you? Very strange people are joining. I even doesn't know who these people are. Okay, just send me a message on the WhatsApp that you have joined. I'm telling to you, Samina, send me a message on WhatsApp that you have Samina or Sai. Okay. Okay. So what is the meaning of insulin index? Because there are some foods other than carbohydrate which can increase the insulin level. Okay, like proteins. If you take a lot of protein shakes, insulin level can go high. If you take a lot of, some food, lean protein, insulin level can go high. Protein can also increase insulin level. Is protein shakes are good or bad for us? Are protein shakes are good or not? What do you think,
So
Ekta?
if we are taking in high amounts, so this is not good for us. I mean, we can
Remember
take in
for
balance.
remember for whole entire life, protein shakes are not original protein at all. They
Okay,
are
so
made to, it's a myth that they are protein. They are mostly powder form of the soya isolates, which are artificially synthesized protein. Protein shakes can cause, first of all, they are not absorbed in our body. They will increase the insulin level. They are absorbed only 16%. These are all marketing fake news as we are buying protein shakes like Herbalife or other things. Remember, protein shakes, if you take a lot, it can cause liver issues, kidney issues. So the best thing is to take a natural protein. Okay, so protein shakes they contain lot of contaminated preservatives, heavy metals. Okay, a lot of, if you keep a protein shake powder outside, nobody will touch also. Even the worms or bacteria, fungus will not be there. Keep a normal protein, bacteria, fungus will eat. So it is a garbage. So better not to take protein shakes, better to take natural food only. And protein shakes, secondly, can increase the insulin level very high. A lot of people on Herbalife, after 1 or 2 months, 3 months, they stop losing the weight. The weight becomes stuck. You will lose 1 kg, 2 kg. But natural diet, you can lose more weight. And it is naturally, if you stop the protein shakes, the weight will come back. But in natural diet, if you have a proper natural diet, the weight will not come back. Okay. So this is called insulin index. But Lot of new things you will learn also in the basic course, like what is the meaning of intermittent fasting. A lot of people do intermittent fasting in a wrong way. Okay, what is good for us? Skipping the breakfast is good or skipping the dinner is good? What do you think? What is good for us? Skipping the breakfast or skipping the dinner?
Skipping the dinner, I think so.
Skipping the dinner is good. Breakfast you have to take. Yes. The answer is
Yes.
whenever there is a scientific cause is also there. Why why breakfast is so important? Okay, because there are in our body genes called clock genes. Okay, anyone has heard about clock genes? What is the meaning of clock genes? No one has heard?
No, sir.
Clock genes are the genes in our body, okay, which are able to, there is a circadian clock when the sun rises. Okay, these clock genes are activated. Sunset, these clock genes are deactivated. That means what happens whenever these clock genes are activated when you are taking breakfast. After that, there is a family, there is a colony of gut bacteria in our body, okay, which can also release some fat burning hormones. But what is the meaning of gut bacteria? Did you heard about gut bacteria? Anyone has heard about gut bacteria? What is gut bacteria?
Gut bacteria, like it's helpful to keep our gut healthy. Like
What
we
they
take
are? Where they are located?
They are usually located in the small intestine. They absorb the nutrients.
Answer is wrong. They are located in the large intestine. When they are located in the small intestine, it's called small intestinal bacterial overgrowth. It is very dangerous. You will get a lot of diseases, dysbacteriosis. You will get also diseases like lot of bloating, lot of indigestion. So the place for these gut bacteria are the large intestine. How many gut bacteria are there, Afroz? Do you know? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How many gut bacteria? 20, 30, 40, 100, 200. How many gut bacteria are there? Any idea? No one has any idea? There are how many, Ekta, do you know how many, yes, tell Afroz, how many gut bacteria are there?
There are many bacteria.
Many means how much? Many can be 1, many can be 10, many can be 20, many can be 100, 1,000. How many? There are,
Trillion.
remember, there are 40 trillions gut bacteria are there, and there is a colony of gut bacteria which can release a hormone called GLP-1. What is the meaning of GLP-1? Afroz, do you know what is GLP-1? What is GLP-1? Anyone has heard about it?
no idea, sir.
That is
GLP-1?
glycoside, sir.
No, it is not glycetide. GLP-1 is glucagon-like peptide-1 hormone. It's a fat-burning hormone. Okay.
Hmm.
And did you heard about Ozempic? Anyone? Vivetika has heard about Ozempic? No one has heard about Ozempic?
Sir,
Ozempic
I
is
heard about
one
it.
of the drug. All film stars are taking it, causes 5 lakhs. And you can lose weight like 7, 8 kg, 10 kg in a month. It is not allowed in India. They are bringing in black. It's called 5 lakh rupees, 5 lakhs, one injection. But Ozempic is it's called GLP-1 agonist semaglutide. Okay. So, if you take for a long time, it can cause kidney failure. It can cause even thyroid cancer. So better not to take it. But our body has got natural GLP-1 hormone. How to activate it? You can activate naturally also the GLP-1 hormone. How? With the help of, if you take a proper breakfast, the clock genes are activated, and they can activate a particular gut bacteria colony called Akkermansia muciniphila. What? Akkermansia muciniphila, ACCROMANSI, Akkermansia. And this gut bacteria can release the GLP-1 hormone. So you can see, you don't have to pay 5 lakh. If you have knowledge, you can get this gut bacteria in free if you are having a proper breakfast and eating some food which is rich in pomegranate or olives or blueberries that can activate this GLP-1 hormone. So knowledge is very important. If you have a proper knowledge, you'll be able to help so many people. Also, you will learn about the hormonal balance diet. Means a lot of people are using now, unfortunately, it's a 40 years old calorie deficit concept. Means you are eating 4,000 calories, you start eating 1,000 calories, 1,500 calories. But calorie deficit diet doesn't give us a kind of a idea what is inside calories. If you take one ball of biscuit, 50 calorie, one apple, 50 calories. So which is good for us? The value is in the micronutrients in the apple. Okay, so that's why. So what happens? A lot of dietitians are using this concept, which is a very old concept. There are many clinical trials has been done. It doesn't work because first of all, if you take a 4,000 calorie, let's say you're taking 5 paratha in the morning or idli dosa, 2 ball of idli dosa, lunchtime 1 ball of rice and 2 ball of rice, evening time again some biscuits or some vada, night time again chapati, dosa. Okay, 4,000 calorie. You reduce the calorie. One morning time one chapati, lunchtime a ball of rice, and night time one idli. Okay, it is 1,500 calorie. But where is vitamin? Where is mineral? Where is protein? Nobody takes care of. So what happens? All calorie deficit diet, the weight comes back very fast. So that's why 88% of the diet plus fails. So you have to learn what is a hormonal balance diet. For that, you have to understand what is the meaning of hormone. So all these diet plans, the basic things you learn in the basic nutrition and clinical dietetics. But most important is the advanced course. If you want to work as a dietitian, if you want to earn money, if you want to help others, then you have to learn about advanced clinical nutrition where you are learning about the metabolic syndromes. Okay, for example, if tomorrow a client comes to you and tells you, look, I have tried 5 dietitian, you are a last hope. My weight is, let's say, 92 kg, height is 5.3, age is 38. My weight is not coming down. I'm eating very less. I'm eating one chapati and vegetable. Going to exercise, nothing is happening. What diet plan you will give? Afros. What diet plan you will give? You cannot give a calorie deficit diet. You cannot make the woman to starve. So here comes the other types of diet plan which you have to learn, which is anti-inflammatory diet, hormonal balance diet, insulin resistance diet, and she will show you one blood report because nowadays everybody is doing blood test. The clients are also very smart. They will do a blood test. They will show you, look, my C-reactive protein is high. My HOMA test is positive. But what is this? You have no idea. You will be in a very bad position. Ekta, do you know what is CRP? Did you heard about it? Afroz, did you heard about it? What is CRP? Yes or no? Anyone has heard about it?
CRP I heard, but sir, I forgot the full form.
Forgotten.
Yeah.
CRP is inflammatory marker. Yes,
Sir.
Afroz?
Yes,
Okay, so
yes, yes.
inflammation
Yeah.
is there. But what is the meaning of inflammation? That also we don't know. What is inflammation? Any idea you have?
The burning sensation is inflammation, sir.
Body sensation is a nerve cells, it's not inflammation. Inflammation has very important role in your everyday life. Whenever your body is in stress, there will be inflammation. What is the basic concept of inflammation? Ekta, did you heard about inflammation?
Yes, sir. When like a foreign like antigen enter in the body, so
So you're telling it's a like infection or it's a kind of allergy like this. But this is also a
yes, due to
part of
that also happen.
inflammation. But inflammation is a very global thing. Whenever the body is in stress, whenever the body there is something injury, there are 5 phases of
Yes, sir.
inflammation. Redness, swelling, there will be heat, pain, loss of function, and inflammatory reactions. Our white blood cells comes, macrophage comes. So
Yes, sir.
when a liver is inflamed, is in stress, so there will be white blood cells coming. Same thing, pancreas is inflamed. When there is a diabetes, it is highly in stress. A lot of insulin production is happening. So inflammation is there. It is, we can see in a report, ESR report or CRP, C-reactive protein. Then the diet is different. The calorie deficit diet is not going to work here. You have to use anti-inflammatory diet. There are separate foods. Okay, if the client will show you, look, my prolactin is high. What it can be? What is HOMA HR test? Did you heard about it, Afros? What is HOMA HR test, Akita? HOMA HR test is a new test which has been done. We will see the level of insulin resistance, how insulin levels are higher. That is done by HOMA HR test. If you see this report are positive and the client will tell, look, my periods are not coming, it is a PCOS PCOD. In PCOS PCOD, we don't give calorie deficit diet. You have to use a hormonal balance diet. That also you will learn. And all my students are able to reverse PCOD. You will also learn how to do that. Because what gynecologists give, mostly they are giving hormonal tablets, which are very, very harmful. Hormonal tablets can cause gallbladder stones, overweight, infertility, and also sometimes uterine cancer. So it is better not to become habitual. You cannot take hormonal imbalance tab for a whole life also. Okay,
Yes.
that is, you cannot take even hormonal tablets for whole life. It is very dangerous. So it is better to do a lifestyle change with a diet. Then it is easy to reverse even PCOS, PCOD, infertility, hormonal imbalance. Thyroid disorders are very common. Around 40 million people are having thyroid disorders. But thyroid disorders also, what people are taking thyroid tablet, which is which it cannot cure thyroid. If you want to cure thyroid, you have to use a proper lifestyle change. Same thing with the Hashimoto disease. What is Hashimoto disease? Anybody has heard about it? Afro, did you heard about Hashimoto disease? Yes? No? Anyone has heard about Hashimoto disease?
So it's an autoimmune disorder
Yeah, very good. It is an autoimmune disorder. Where it happens?
in the thyroid
Yeah,
neck gland.
yeah. Mostly it happens in the thyroid. It is when inflammation of the thyroid gland happens. When there is a lot of T cells. It can happen when you take a lot of gluten. What is gluten? What is gluten? Anyone knows? Gluten, you heard about gluten, yes, Ekta? Yes, but what is the meaning of gluten?
Yes.
What is the meaning of gluten? Gluten is a,
It is a protein found in the
it is found in
plant
wheat, mostly wheat.
meat.
A lot of people are taking wheat, chapati, any kind of bake, food which is rich in wheat or refined carbohydrates. You are getting what? Gluten. Okay. So what happens is gluten. Gluten, what happens generally when you eat all this food rich in wheat, our body can get lot of this gluten can slip inside our body. Okay. So, and what happens generally? Our body will start taking antibodies. What is the meaning of antibodies? Means when in our gut, what happens? There are kind of a lining called villi. Everybody knows, yes? These are the linings inside the gut. When gluten comes, that can destroy the linings called villi, like here. And this gluten slips, leaks, like leaks. The tire is leaked, the balloon is leaked, same thing. Here it is leaked here, inside our intestine. This is our villi. This is a kind of our intestinal linings. This is a normal intestinal lining. These are gluten molecules or lectin molecules. Lectin are also plant proteins which can cause inflammation. It slips inside our body, and a body will see it as an enemy, and it will create antibody. And these antibodies are so much created, they can come and attack thyroid gland. Understood what is Hashimoto disease? Yes. So what diet plan you will do? You have to reduce the inflammation. So it will be anti-inflammatory diet. Remember. You will also learn about the diabetes diet plan. Diabetes diet plan, I will especially, I will focus on it after few minutes. Okay. Also, there are many new types of diabetes are there. Diabetes 1.5. Anyone has heard about diabetes 1.5? Afroz, you heard about it? Diabetes 1.5, yes or no?
No,
No
sir.
one? So that's why you are here. You learn a lot of new things. Okay, these are new type of diabetes, and you will be knowing how to reverse it also. Diabetes type 2 and 1.5 can be reversed. Diabetes type 1 cannot be reversed. It is your pancreas doesn't create insulin, but you can control it. Okay. About fatty liver. Every day I'm getting patient about a fatty liver. It's very common. Around 80% of the population have got fatty livers in India. A lot of people doesn't know. When you do a blood test, HGPT, HGOT, you come to know. And there is no medicine for fatty liver. One girl, came to me. She was very thin. When I see the report, I was surprised. HGPT should be 32. It was around 115. HGOT should be around 30, 36. It is around 125. Third grade 3. After some time, the liver could have damaged. Then I asked what you are eating. She was telling morning time 4 idli, a dosa, lunch time 2 bowl of rice, evening time 3 bowl of rice. She thought if you take rice, you will increase the weight and you get fatty liver. Rice will not increase the weight. It will give you fatty liver if you take protein and other food. So after 3 months, she was able to cure it. Fatty liver cannot be cured by any medication. You have to use a proper diet plan. Uric acid also same by diet plan, high blood pressure, cholesterol, gastritis, acidity. Also, you will learn about the chronic constipation because a lot of people have constipation and the weight is stuck. Most of the people will have constipation. How to overcome it? IBS, leaky gut, that also you will learn. Just now I given you the concept of the leaky gut. When the gut has been, inflammation happens in the gut. Okay, there are many diseases, ulcerative colitis, then IBS, irritable bowel syndrome, which the diet is very important here. There is no direct medicine, or arthritis, or even vitiligo and psoriasis. Menopause diet plan also you will learn. Pregnancy diet plan, because pregnancy diet plan is completely different. So you will learn about it also, and also child nutrition, because child nutrition is not taught in MSc also in nutrition. So it's a different subject, because children from 8 months to 16 years, what food has to be given to make them much, healthier, or lose weight or weight gains to make them much more effective. A lot of children are focusing now have ADD. What is ADD? Attention deficit attention deficit disorder. They don't study at all. They are running and they are creating autism issues are there. ADHD, attention deficit hyperactive disorder. These are also, there are diet plan for it that also you will learn. Okay. Now, if you see as the good thing about this, course is that you will be able to have a proper, practicals. Practicals means you will get the client. All my students are getting clients after 3 months. How you get the clients? I have a marketing team. Around 20 people are working. So we do a lot of, investment in Google, Instagram, Facebook, online marketing, email marketing. So you get a lot of clients, and these clients are given to you. In the end, I will discuss why clients are needed. Because without clients, you will not get a practical experience. A lot of MSc, a lot of doctors are coming to do the PG courses because to have a hands-on experience. I'll show you that many of my students. This is one of my students, Jigyasa. She is one of them. She was also MSc. She was able to reverse diabetes. You can see here, the diabetes was reversed. This woman was having around 152 fasting sugar, which should be less than 100. In 25 days, it came down to 93. HbA1c was 8, it came down. So diabetes reverse. You will also learn how to reverse diabetes. Okay. Now this is another example. This woman was having 208 sugar level, very high. It came down to 96 in 40 days. The HbA1c was 8.9, very, very high. Came down to 5.6. Diabetes reverse. This is another student has reversed. 197 sugar level came to 89, 190 to 100. So diabetes can be fully reversed. If you know insulin resistance, we will discuss about it how. This woman, Mrs. Sarika, was my client. You can see her sugar level was 400. When she came to me, her weight was around 88 kg. She was a fatty liver. She was taking insulin injection. HbA1c was very, very high. It was around 10. After she was taking insulin injection 25 minutes, but when she started changing her lifestyle, she started taking a proper, diet. After 3 months, she was completely out of insulin. There is no need to take any insulin. Slowly, insulin level came down after 1 month to 6 units. Then after 3 months, she reversed. In the 4th month, she stopped taking medication. Sugar level came down to less than 100, HbA1c to 5.4. You can see the person, same person looking 10 years younger. So in this way, we will learn how to reverse diabetes also. But why a lot of people tell I'm taking medication, diabetes is cured. It is not true. If you take medication and your medicine will keep on increasing the dose. If first you take, let's say, metformin, then you take sulfur drugs, then you take gluticazone, then you take injection insulin. After that, your kidney damage, heart attacks happens. Mostly to the diabetic people. Answer is only by taking medication is not enough. If you take a proper diet plan, I'm not stop taking medication. If you take a proper diet plan, lifestyle change, afterwards you will reverse diabetes type 2. You don't need it, medication. Okay, but why diabetes type 2 is so dangerous? Because you can see there are many consequences. Blindness, as far as WHO. You will see there are also kidney failure, heart attacks, strokes, limb amputation. What is limb amputation? This is how the legs are amputated. Why? Because sugar environment can grow, fungal growth and bacterial growth. No medicine is going to work. Amputation of the gangrene can happen. But why cardiovascular disease? For that, you have to understand what is the meaning of HbA1c. What is HbA1c? Anybody knows? Ekta, did you heard about HbA1c?
No, sir.
Sir, it is a blood test that provide the average measure of sugar in the body, sugar in the blood, I mean.
You are very good, but it is not only sugar. It is Hb. What is Hb of Rose? Hb is hemoglobin. Means sugar in the hemoglobin. What is the percentage of the sugar in the hemoglobin? What is hemoglobin? Ekta, you know hemoglobin? Vivetika, hemoglobin? It's a protein in our body found in blood. Okay, what does it do? Okay,
It carries oxygen.
it carries oxygen to your body and they take away the carbon dioxide. Basically, they are doing a function of gas exchange, but it's a protein, isn't it? So what happens when you're taking lot of carbohydrates, rice, chapati, idli, dosa, whole India is eating this only, 80%. So lot of glucose will combine with the hemoglobin and become a very sticky substance. Okay, it will start scratching our body tissues. You will see a lot of people will tell, I have severe body pain. I don't know why it's happening. Stop taking carbohydrate. You reduce it for 2 weeks. It will go because this HbA1c, the blood becomes so, very much thicker. It will scratch our bodies everywhere like joints, body pains, and it will scratch the arteries. Like you take a frying pan and scratch it with a knife, and it will damage the arteries, innermost layer called endothelial layer. This is how. This is a normal artery. HbA1c will scratch it, and it will happen. It will become vulnerable for inflammation. Means bullet LDLs are there. Okay, what are bullet LDLs? These are the LDLs which are combination of what? The combination of glucose and cholesterol, and they're very small inside. They can get inside. They are oxidized LDL. These are bullet LDL. These are new type of LDL found. Okay, cholesterol plus glucose. Glucose is coming from all carbohydrates. They will get inside the endothelial layer here, like here. Understood? Yes. And what will happen? Inflammation. As I told you, our bodies, antibodies, soldiers will come and attack. They will think, why you are coming here? And there will be inflammatory reaction called macrophage will come and there will be foaming reaction, and this inflammation will be so high they can narrow the artery. Artery is like this, they narrow it, and blood cannot pass, and it will damage the tissue and heart attacks. So this is the reason why most of the cardiac patients are there. Most of the diabetic patients have got heart attacks. Okay, and definitely if you want to save these diabetic patients, you have to reduce the HbA1c. How to do that? With a proper diet plan, then you'll be able to reduce the HbA1c. Okay, and diabetic conditions, the HbA1c can destroy the kidney also. So kidney failure is very common, and most of the diabetic patients are doing what? They are doing dialysis. Okay, and also most of the diabetic patients have kidney transplantations, and dialysis is not so cheap also. The dialysis can cost 7,000 to 10,000 per day, and you can understand you have to do around 15 times. It's already 1.5 lakh per month plus, or you have to do a kidney transplantation. Kidney transplantation is mostly also very expensive. Okay, it is 40-50 lakhs. So it is everybody cannot do it. So that is the reality of life. So a lot of people have a fatal consequences. Diabetic can also cause neuro, that is pathy, means the nerve cells. If you pin with a, you take a pin and you can, the leg will not feel it. Okay, this is nerve cells are destroyed. Retinopathy, eyes are, eyesight destroyed, retina is destroyed. High BP, whole body is affected, and slowly gangrena. So you can understand amputation of the leg. So all these situation can be controlled if you have a proper diet plan. All these things will not happen. Even these things is stopped in many cases if you have a proper diet plan. Otherwise, if you take a medicine and don't take a diet plan, you are going to have all these things: cardiovascular disease, heart diseases, retinopathy. So that's why only by taking medicine you cannot win over diabetes. You have to have a proper diet plan. Then you will see that the doses will come down. In many cases, you can cure the diabetes also. As I was telling, there is a new type of diabetes is there. Diabetes 1.5. Okay, I think nobody has heard about it. This is called LADA, latent autoimmune diabetes. Means it's mostly happening in the with the antibodies. There is an antibody which is increased there. Okay, this antibody is called GAD 65, glutamic acid decarboxylase 65. This antibody is increased, and that is the indicator of this diabetes 1.5. What happens? Mostly the diabetes 1.5 is associated with not obesity. You'll see the diabetes happens and the person is losing the weight. It might be diabetes 1.5. Okay. Also, it can happen like this, that there are other diseases are there also. Okay, like Hashimoto or arthritis, then the diabetes is happening. So that's why whenever the diabetes is happening with other if a person is having other immune diseases, okay, then it is very high chance that diabetes LADA, it is latent autoimmune diabetes. So how you diagnose it? You have to see the C peptide. C peptide is a kind of when the insulin has pro-insulin. Means before insulin is formed, there is a pro-insulin, it is combined with a C-peptide. That is a bond is there, protein. But when the insulin is formed, the C-peptide is released. So when there is a low C-peptide, means insulin is not there. It is lower than 0.5. It might be a kind of a LADA. Okay, if it is normal or it is very high, then it is diabetes type 2. So don't worry. I'm just giving an overall idea. We have 5 lectures in diabetes. Okay, don't worry. Now, if you come to the conclusion that what you learn has to be integrated with the practicals. For example, there are very simple things. If I tell you, what is the meaning of, let's say, one bowl of rice you are eating. Everybody likes rice. In one bowl of rice, let's say 200 grams of rice. How many grams of glucose is there? What do you think? Afroz, what do you think? In one bowl of rice, how many grams of glucose is there?
No idea about that, sir.
In one bowl of rice, you will get around, let's say 200 grams of rice, 100 grams of rice, you get around 40 grams of rice, 40 grams of glucose, sugar. Okay, in one bowl of rice, 200 grams, 80 grams of glucose is there. Remember. Okay. Now, when you eat one bowl of rice, what will happen to you? Okay, you are eating there one bowl of rice, it will enter your stomach and it is already becoming glucose. It will end up in the intestine with the glucose. And intestine, it will be absorbed in the blood. The intestine has got small pores like villi, and sugar level increases in the blood. Insulin comes and takes away, it will grab the glucose from your blood. Okay. Yeah, everybody can hear me? Yeah. So insulin comes and takes the glucose from your blood. Okay, glucose is a sugar. Everywhere it is there in idli, dosa, rice, chapati, any grains. High glycemic index. Now what happens? This glucose is distributed to your body. Okay, but how much the body can take? The body can take in one time around 20 grams. That is the maximum ability of the body. Body takes to glucose to get some energy, 20 grams. What is the balance? 80 minus 20, 80 grams you came from 100 to one bowl of rice, let's say 200 grams. The body can take only 20 grams. The rest 60 grams, where it will go, which organ? It will go to the liver and turn into fat. This is how people get overweight. Nobody eats fat every day, isn't it? Where you see a person taking one bowl of butter. So everybody is becoming overweight. How? When we are taking a lot of carbohydrate. So if one day 100 grams is increased, in a month 2-3 kg increased. In 6-7 months, 14-15 kg increase. In 1 year, 30 kg increase. This is how people become overweight. And 85% of the people in India have got belly fat. Cholesterol. This fat is coming everywhere. From extra carbs converts into fat, remember. But what is the solution? You cannot tell a person. You cannot tell from tomorrow, okay, stop taking roti, chapati, idli, dosa. You cannot do that. Nobody will listen. Everybody will tell you, I cannot live without rice and chapati. So this is not the solution. The solution is this. There are certain fat burning hormones that are in our body. Okay. Anyone can tell what are the fat burning hormones? Ekta, do you know what are the fat burning hormones? What are the fat burning hormones? Did you heard about it? today in the beginning I told there are GLP-1, GLP-2, these are the fat burning hormones, somatotropin hormones. All these are fat burning hormones. Okay. But what hormones are made up of? What is the meaning of a hormone? Anyone knows definition of the hormone? What is the meaning of hormone? Any idea? What they are?
Hormones are the soluble protein, kind of soluble protein.
But what they are? What is the correct definition? There are many soluble proteins out there. Hormones are our body's communication. Like you
They are
send messages to WhatsApp, email. This is hormones. Hormones are giving instructions. Okay, there are more than, yeah, just mute yourself. Okay, Afroz. There are more than 700 hormones are there, and there are some fat burning hormones. But what hormones are made up of? Hormones are made up of vitamins, minerals, proteins, fatty acids. So if you take only chapati and reduce chapati, calorie deficit, that will not give you a hormonal balance. So the food should contain vitamins, minerals, protein, fatty acid. It should be a complete balanced diet. Then only the hormonal balance will happen. Also, every time the food you are taking, morning time chapati, idli, dosa, lunchtime rice or upma, evening time poha, night time again rice or chapati. Every time insulin level is high because lot of carbohydrates people are taking. And insulin is a dominating hormone. When insulin levels are higher, no fat burning happens. This is also called insulin resistance. So you can see a lot of people are going to gym, but there is no result. They will tell, okay, I have worked out so much, no result is coming. I have taken so many diets. Insulin resistance, insulin levels are high. So diet will give you around 80%, 20% exercise, but exercise is important. It doesn't mean that you should not do exercise. But if without that, exercise will not be giving you good results. Okay. Now, what is the meaning of in the gym? Are you burning the fat? Yes or no? What do you think? Ekta, do you know that in the gym we burn fat or we don't burn fat? What do you think in your opinion? Do we really burn fat in the
So
gym?
rather than fat, we gain muscle mass.
But the thing is that in the gym we never burn fat. Okay, in the gym what you are burning is the glycogen. Okay, it's a myth that in the gym you are burning the fat. Okay, because in the gym you never burn a fat. If somebody is going to gym, after 40 minutes he will burn glycogen stored from carbohydrate. Okay, to fat burning takes around 5 or 6 hours. It's not possible to burn in gym. Fat burning happens in the resting phase. When people are sleeping, if you sleep properly, the fat burning will be much better. This is a window when fat burning happens, 11 to 1 a.m. when fat burning hormones are very active. So you will see a lot of people are going to gym but not sleeping. They will ask you, I'm not getting results. You ask how much you sleep. They will tell you, no, I'm sleeping 5 hours, no result. So that's why you have to see that the sleep is important. Number two, you have to see this insulin levels to come down. So the diet should contain with a proper combination of food so that insulin level can come down. Then only you'll be able to have a proper value of your, you'll get a proper results. So in this way, you'll see all my students are able to, create diet plan. People are losing weight. The 3 kg in a week, you can say 24 kg in 90 days. It's not a magic. Naturally, no supplement. With the help of the knowledge, lowering down the insulin level and adding vitamins, minerals, protein, a balanced diet that will make the insulin level low. Okay, you'll also learn when the weight loss happens properly, you'll see the person looks much younger because there are many factors are activated, sirtuins, which are, which is makes anti-aging factors activated. So you'll also learn how to create a diet plan in such a way nobody, everybody is, going to one dietitian, two dietitian, three dietitian. Then they will come to you. If you know that concept of insulin resistance, lowering your insulin level, you'll be able to help many people. A lot of dietitians, MSc, BSc doesn't know about it. That's why they come to study. Now, there is a carbohydrate addiction is also there. A lot of people will tell you, I cannot live without carbohydrate. I got craving because it is true because there is a part in the brain called nucleus accumbens where the neurons are get activated when you take carbohydrate. And carbohydrate addiction is 8 times stronger than tobacco, alcohol. Same part of the brain is affected, nucleus accumbens, because it is releasing dopamine. The brain releases a happy hormone like GABA, serotonin. You become happy, so the body becomes dependent. So you need a lot of carbohydrate. Every time you eat carbohydrate, you need more because these dopamine receptors are downgraded. But there is a way how to do that. Otherwise, no diet plan is going to work. There is a way to how to do that. You have to add potassium, magnesium, chromium, zinc in your diet, omega-3. Then you will not get the craving. This nucleus accumbens is reset. Okay. Now, what is the meaning of insulin resistance? As I was telling, insulin resistance is very important. So let us find out what is this. Look, to understand the insulin resistance, let us go a little bit back. What people are eating nowadays? North India will take paratha or poha. South India will take idli, dosa. In the morning, 100 grams of glucose is coming. Lunchtime again rice, chapati. Evening time again upma. Or people will take rice. 300 grams, 200, 300, 400 grams of glucose is going to your body. Sugar. How much the body will take? The body can take around 20 grams in one time in a day, 60 grams. The rest is going to your liver and turn into fatty liver. From where fatty liver is coming? This is the answer, non-alcoholic fatty liver. Around 70% population have got fatty liver. And fatty liver can be treated only with the natural way. This girl I was telling 100 to 112 was AGP, AGOT, fatty liver, grade 3 months reverse with the natural diet. We also learn how to do that. Same thing here, you can see belly fat, all these things are visceral fat. And ultimately it will give us metabolic syndrome. 75% diseases is a metabolic syndrome like diabetes, hypertension, cardiovascular disease, fatty liver, PCOD, cancer. Why cancer? Because my research work is on cancer diet. Cancer cells grow on glucose. They eat sugar, glucose, and they don't require oxygen. This is also called Warburg effect. So in cancer diet, what do we do? You have to use a special food that is, you have to stop the supply chain of glucose. Otherwise, the cancer cell will grow and we give other source of, energy. But we will not talk about cancer today. We will discuss other things also, like diabetes. Why diabetes happens? Because high level of carbohydrate, insulin increases. More carbs, more insulin. Okay. What people are eating from morning to evening? Carbohydrate. And India is #1 diabetic capital of the world nowadays, remember. So how it happens? Look, our body is made up of cells. Each cell has got a small lock, which is insulin comes and opens it. Like you come to your home, open the lock with the key. Insulin acts like a key. Okay. And there is a small channel called blood from which sugar goes inside. It opens and sugar goes inside the cells. Now what happens? Imagine you are having one key. You can open the lock and the door opens, you go inside the home. Imagine you have got 5 keys, 6 keys. You cannot enter 6 keys inside the lock. The lock requires only 1 key. The lock will not work. The door is closed. You are outside. Same thing happens when your insulin increases more and more. Why? More food with high carbohydrate. Rice, chapati, idli, dosa, upma, whatever, poha. More insulin. More carbs, more insulin. Then receptor will not respond. Then doors are closed. Then sugar is where? It cannot get inside. It is outside. This is called insulin resistance. And understood, everyone? Ekta, Arphos, Vivetika. And what are the symptoms? This extra carbohydrate converts into fat, so you weight gain. Hunger, body is not getting anything. Inflammation, whenever there is a more pancreas is creating more insulin, more carbs, inflammation, weight gain. All diseases are coming. Fatty liver, because all carbohydrates will go to the liver first and convert into fat, fatty liver, diabetes, cardiovascular disease. And here you can see insulin is high, glucose, it is not responding, glucose is outside. So slowly, the person will, there a lot of people will tell after eating food, I get hungry. These are the symptoms of what? Insulin resistance. Or people will tell you, okay, that I am having, I am having lot of craving. These are all symptoms of insulin resistance, remember. Okay. Initially insulin resistance, afterwards the sugar level increases and it becomes diabetic. Clear now how diabetic happens? Okay. Understood? Why diabetic happens? Because first of all, the insulin level increases so high that the body cell receptor does not respond to insulin and our sugar stays in the blood. This is the concept of diabetic. Now, how to cure diabetes? To cure diabetes, you have to create a diet plan that will lower down the insulin level. When insulin level is coming down, receptor will respond. Understood? And sugar will come inside the body cells. Okay, so that's why you have to use, and also you have to use anti-inflammatory diet because there is inflammation in the liver. A lot of insulin is created, and liver, whenever there is a lot of inflammation, a lot of insulin is created, there will be a lot of byproducts and there will be inflammation. That's why when after some time there will be white blood cells coming, macrophage will destroy the pancreas. Then you require insulin injection sometimes. Okay, but if you create an anti-inflammatory diet, inflammation can be stopped. Like think you are in outside in a big field, 100,000 cars are starting their engine. Lot of noise, lot of gas will be there. Policemen come and stop them. Same thing. When pancreas is overfunctioned, this is releasing a lot of insulin. There are a lot of byproducts are there. It will create a lot of mess. Then our macrophage will come. Whenever the pancreas or any cell is in stress, they will release inflammasomes, interleukins, or let's say they will release cytokinins. And macrophage comes and start destroying the pancreas. So if you create an anti-inflammatory diet, the macrophage will be stopped for destroying, and you can save the pancreas. And if you create a diet which is lowering your insulin resistance, you can help the person with diabetes. You can see a lot of diseases can be overcome. When insulin resistance is there, the body is not getting vitamin, minerals, protein, fatty acids, hormonal imbalance, then potassium is not there, muscle cramps, constipation, kidney stones, gallbladder stones, because nothing is getting inside the body cells, it is getting together in other places like kidney or in gallbladder. Muscle mass loss, all these things, body pains. So there are symptoms of insulin resistance, which is like weight is stuck, fatigueness, craving. Sometimes you will see that hormonal imbalance can happen. Body not getting vitamin, minerals, protein is blocked. You can see the PCOD, thyroid, everything happens. So there, if you get a client, when you see that how much diet they are taking, nothing is happening, is insulin resistance. You have to see the insulin levels are higher. Okay. Now there are other diseases which are also due to the insulin resistance, is the uric acid. So why uric acid happens? It doesn't mean that every time by taking protein it can happen, because you have to understand there is a concept of ATP. What is the meaning of ATP? Do you know? You heard about ATP, Afroz? What is ATP? Heard about it?
Yes, sir. Adenosine triphosphate.
Adenosine triphosphate.
Triphosphate.
Okay, why it is very important? Because whenever you take a lot of carbohydrate, a lot of idli, dosa, first it will convert into ATP. Then it will convert into ADP, and it will convert into uric acid. So that means when you take a lot of carbohydrate, you can get uric acid high. So in order to lower down the uric acid, you have to reduce the carbs also. And uric acid can block the enos. What is enos? Endothelial nitric oxide synthase. What does it mean? It can cause, enos is a kind of an enzyme that is making the blood vessels, it dilates. So blocking the enos means the blood becomes very constricted, and a BP can go high. That's why a lot of high level of, this sugar level is high, BP can go high. Okay, and uric acid can cause other issues like gout. Okay, you will know how to create a diet plan for the gout also. Okay, now everybody has heard about PCOD, but how PCOD happens? What is the concept behind PCOD? If I ask you, will tell me hormonal imbalance, but how does it happen? PCOD also happens due to the insulin resistance, remember, because our woman's body releases a kind of a, our woman's body releases estrogen, okay, from ovary, but woman's body also releases androgen from where? A small amount from testosterone ovary. But when your insulin level increases, when insulin level increases, when you are taking a lot of carbohydrate, insulin level increases, androgen level increases, give rise to, which will be very low in women. It can give rise to hair thinning, acne, facial hair. Okay, it can give rise to irregular periods. Okay, acne, all these things, hormonal imbalance. Initially, the person can have flow is less, or hair loss, weight gain, all these things afterwards cyst formation. Then there will be very painful cyst, bleeding, infertility. What gynecologists give? Gynecologist is giving hormonal tablets, which has got many side effects like uterine cancers. If you don't treat PCOD, it can give rise to endometriosis, fibroid. Fibroid means operation. So in order to reverse PCOD, what you are doing? It can. I will show you all the examples where you can see this woman. This is my student has reversed PCOD. 6 centimeters disappeared in 48 days. Another example, in 1 month she is disappeared, and this period started restored. Same 85.5 kg reduced. Now, how to reverse PCOD? You have to lower down the insulin level. When insulin levels are higher, your androgen increases, lower down the insulin level with the diet plan. Automatically, the androgen level will come down. Insulin coming down, androgen level will come down. In 3-4 months, PCOD reverse. There are a new type of PCOD that is called lean PCOS. Not every time the women with overweight women are having PCOD. There are some category of the women, they're thin, they can have lean PCOS. A lot of girls, they tell me, I don't believe how can I PCOS. I'm so thin. It doesn't matter. So when you're thin, also hormonal imbalance can happen. And at that time, you have to use a anti-inflammatory diet for lean PCOS. That also you will learn. Thyroid disorders. Thyroid disorders are very common. Thyroid is a gland which is creating a hormone called T4. But when the T4 is less, become hypothyroidism. What we give? Thyroid tablet. But thyroid tablet is not the cure of the thyroid. Why? Because you have to take whole life. And all other symptoms are relevant, like fatigueness, energy level low, miscarriages, infertility. But if you create a proper diet plan where the thyroid hormone gets vitamins, minerals, protein, fatty acids, zinc, selenium, iodine, then that hormone can be synthesized. So in this way, you will see that a lot of my students are able to reverse thyroid. This girl, she was also having Mrs. Sangvi 23.5 THS. THS means it's a indicator of hypothyroidism. When T4 is less, it gives a signal to the hypothalamus. It releases TRA, thyroid releasing hormone. It gives a signal to the pituitary gland, and more THS means hypothyroidism. So it came down. Here also, in 3-4 months, the person stopped taking medication. This woman was having 39.7 THS. It came down to 5.4. With a proper diet plan, you will see that thyroid can be reversed. You have to add, because thyroid is affecting the whole body. This is called heroarcher, like placental. It can give rise to miscarriages, duodenum, fatty liver. But thyroid, with the help of diet plan, you will be able to reverse thyroid and Hashimoto also. Okay. Now, very interesting thing. What is good for us? Egg yolk is egg white. What is good for us, Afroz? Do you know? Vivetika, what is good for us? Egg yolk or egg white? What is good for
Egg
us?
good for
Egg
us.
white. Egg white
Yes,
is
sir.
good for us. No, the answer is wrong. Why? Because look, a lot of people think egg yolk is fat, but it's a healthy fat. Remember, it is omega-3 HDL. So you have to understand egg yolk contains also protein. Okay, egg yolk also contains lot of micronutrients and macronutrients, which is much more advanced than the egg white. A lot of people doesn't know about it. There are research work which is shown the egg yolk contains iodine, selenium, zinc, copper, iron, magnesium, calcium, phosphorus, so many macronutrients. Choline is an antidote for cholesterol. It is low. It helps us. It is a healthy cholesterol. It is HDL. It contains lot of micronutrients, macronutrients, vitamin A, vitamin D, vitamin K. So egg yolk is rich in amino acids, even protein, high quality. So never throw the egg white. And also egg white has got high insulin index. Means it can increase the insulin level, fat burning stops. Imagine what will happen if you take 5 egg whites. And egg yolk has got low insulin index. It is a fat, because insulin level can go high. Number one spiker is what? Carbs, then protein, then fat. So when you take full egg, the buffering happens, means the insulin level can go down. So it is good for us. Now, snacking is good or bad for us? What do you think? Snacking is good or bad for us?
Healthy snack is good.
Healthy snack is good, unhealthy snack is bad. Okay, the answer is again not correct. Why? Look, there is a clinical trial done by Professor Guyton. He got Nobel Prize for it. What is written here? All aspects of fat metabolism are greatly enhanced in the absence of insulin. Means where there is no insulin, fat burning happens. When there is insulin, fat burning doesn't happen. It is done by a scientist who got Nobel Prize called Guyton. So let's see what will happen if you take a lot of snacks. Insulin level will go high. Even healthy snack will increase insulin. Anything will increase insulin level. Going high here, going high, going high. And when there is insulin level goes high, in the presence of a tiny bit of insulin, all fat burning hormones are shut down. No fat burning will happen. Secondly, fat burning is stopped. Also, when you are taking snack, the hunger hormone is increased. What is the meaning of hunger hormone? Do you know? What is hunger hormone? It is called ghrelin. So you are increasing ghrelin. So if you take snack, you will eat more food. End up with more. Unfortunately, nowadays also I see even MSc people are sending me diet plan with snacks. Earlier it was thought when you take snacks, you will not get hungry. It is opposite. Now the research has shown more snack, more insulin, no fat burning. Also, it will increase more ghrelin, hunger hormone, more craving, gastrin. 5 hormones are released. Gastrin will make you more hungry. GIP, gastrointestinal hormone, and CCK, cholecystokinin, secretin. The person eats up with more food. So that's why snacking is a very old practice. Nowadays, only 3 meals. Breakfast, lunch, and evening. Not a question is the client may tell you, I will get hungry. Nobody will get hungry if you have a proper diet, balanced diet. If you take a lot of idli dosa, definitely you will get hungry. If you take idli a little bit, you add vitamins, minerals, avocado or some healthy fats, micronutrients, nuts, insulin level goes down. You will never feel hungry from breakfast to lunch to dinner. Okay. Now, what about which vitamin is less in vegetarian population? What do you think? Which vitamin is less in vegetarian population? Vitamin D. Remember, vitamin D is deficiency is there in vegetarian population, but vitamin D deficiency can increase the weight. How? It's very interesting concept. Vitamin D deficiency can increase the weight because when the vitamin D is less, the cortisol level can go high. Cortisol is a fat gaining hormone. It can stop the fat burning. Number one. Number two, vitamin deficiency can cause gluconeogenesis. Means 3 words, gluconeogenesis. What does it mean? Somebody is coming back. Okay. So what happens when you're taking a lot of vitamin D deficiencies is there, then our body's muscles are converted into sugar. Ekta, I was just telling about when there is a vitamin D deficiency, it can increase the weight. Did you heard about it?
Sorry, sir.
Vitamin D deficiencies means low vitamin D can increase the weight. Did you heard about
Okay.
it? It's a very interesting thing. Why? Because vitamin D deficiency can increase the cortisol level. Cortisol is a stress hormone. And what happens when cortisol level increases? Fat burning stops. Cortisol is a fat. It can stop it is like insulin. It can stop the fat burning. Secondly,
Okay.
when there is a vitamin D deficiency, it can enhance the gluconeogenesis. What is gluconeogenesis? Remember, what is this? It's a conversion of
Con-
proteins into glucose. Muscle mass is
okay.
lost. So you will see a lot of diabetic people are mostly vegetarian. If I see some patients from Rajasthan or Gujarat or Haryana, I ask who is diabetic, go home. Somebody, it's fine. So in diabetic diet, and you have to add vitamin D also, minerals also, protein also. Okay. Milk is good or bad? What do you think? Milk is good or bad?
Milk
What do
is
you think?
good, but many people they can't digest milk. They have
Okay.
gastric problem with milk.
Another new thing you learn. Do you get calcium from the milk in your body?
Yes,
No.
sir.
The
No.
answer is no. Because
No.
the latest
Okay.
research has been shown calcium cannot be absorbed without vitamin D and magnesium. The milk calcium is not for our body. It is gone. Cow, mother cow gives the milk for whom? For human? No, she doesn't know you, Afroz, Ekta, Dr. Joy. She doesn't call you, I'm giving the milk for you. It is given for the baby cow. Baby cow can absorb milk because they have a 4 stomach. We don't have it. Human cannot absorb any calcium from the milk. It's waste. Remember, instead, when you drink milk every day, you can get osteoporosis. What is osteoporosis, Ekta?
So it is weakening of bone.
Yes.
Yes, yes.
So milk will make your bone weaken. Why? Because milk is acidic, lactic acid. If you drink milk, our body's blood will become mostly acidic. Then what happens? You have to become basic. It will take the calcium ions from the bones. So drinking milk every day can cause osteoporosis. So you can understand most of the osteoporotic nations are drinking milk drinkers. Generally, why we drink milk? Because in USA the milk dairy industry was dying, so they give a government notification you have to drink milk. Then it came to India. At the same time, if you drink milk every day, you will increase the weight because milk contains a sugar called lactose. Inside the milk there is a sugar. Without adding any sugar, lactose is there. And this lactose is not absorbed by the human body. It will enter the liver and turn into fat. Milk can be given to the children up to 6-7 years. They have got an enzyme called lactase. They can digest it. Elder people cannot do it, cannot digest it. And also milk contains hormones. Nowadays, milks are added with lot of hormones like artificial oxytocin. Okay, so that the cows are given a lot of hormones to make them to give more milk, and you are drinking this, it will cause PCOD or other breast cancers. Lot of milk drinkers are having breast cancer nowadays. So you can understand what is the use of taking milk. Because there are synthetic estrogen has been given to the cow nowadays, and we are drinking this. Also, if you drink milk every day, you can get vitamin D deficiency. Why? Because what is the name of the protein in the milk? Called casein. And casein is not very difficult to digest, assimilate in our body. If you drink milk every day, our liver work will be only working on the casein, assimilation. Other functions will be disrupted, and it can cause even vitamin D. So milk is a very old story. Drinking milk, as per Yale University study, it contains lot of side effects. Also, if you take milk every day, in dairy products are not given in PCOD and diabetes, can cause inflammation. Understood? Yes. Chicken is good or bad? Afroz, what do you think, Zeba? Chicken is good or bad?
The lean meat is good.
Lean meat is good. Yes, but if you take chicken every day, what is going to happen? Now, for that, you have to understand where chickens are grown nowadays. There is no domestic chicken. Every chicken is a farmhouse chicken. How chickens are grown? Small chicks are given injection of diethylstilbestrol or synthetic. They are given also RGBH. There are hormones, growth hormone. Okay, when chickens are small, they are given hormones to make it bigger. You can see that chicken are growing in 1 month. It should grow in 5 months. How they are grown in 1 month? With the help of the manipulation of hormone imbalance. And when the hormones are given, you are eating this meat, you are eating hormones only. Also, when hormones are given, the immunity is low, and there are lakhs of chicken together, hundreds of thousands. They are given injection of antibiotics, and you are eating these antibiotics. So eating chicken every day, you are getting doses of hormones, antibiotics, pesticides, because the food the chicken is getting is full with omega-6, because that make them very bulky. So eating chicken every day, you have to think twice. Once in a while, once in a week is fine, but every day, I have seen so a lot of girls, even 11 years old girls are getting PCOD nowadays. When I ask what you are eating, every day chicken milk, so you can understand. So chicken is not, I'm not telling chicken stop taking chicken, eat chicken, but we have to eat other source of protein also, which are including the plant proteins. But protein taking is not enough, it has to get absorbed, it is not absorbed. If you have a proper combination of the food is needed. Okay, and the food should be plant protein has to be 60-70% also. Animal protein has to be there, but plant protein also. It has to be a combination. The food calorie deficit diet doesn't work at all. Why? Because in a calorie deficit diet, what happens mostly, you will get deficiencies, and deficiencies means your hormones will be not balanced. Weight will come back. So calorie deficit diet is a very old concept. If you want to have a proper diet plan, it should be a hormonal balanced diet, or it should contain all the macronutrients, which will be able to fulfill the needs, and also insulin levels to come down. Then only fat burning is possible in a natural way, and hormonal balance will happen. All these issues are of hormone imbalance, like fibroid, ovarian cyst, all this can be balanced. Weight gain, tiredness, acne, facial hair, mood swings, all are hormonal imbalance. So only by theory is not enough. So we have a practical also. What is the meaning of practical? Means after 2 months or 3 months, you will get some clients. When you get the clients, this group I am taking, so I will guide you with the diet plan. I will give you a template. You create a diet plan and send to me. Then you create a WhatsApp group. You client, and you can add me or my teachers. And there has to be a follow-up. If you give a diet plan until goodbye, nothing is going to happen. Follow-up is important. Follow-up is done how? Every day the client is to send a photo of the weight machine, so we can see the weight is coming down 100 gram, 200 gram in a month, let's say 5 kgs. Or weight gain is the goal. It will increase around 100 gram per day. And you have to send a photo of the food, because there will be mistakes. A lot of people do mistakes. Like one of my clients was telling, doctor, I am not losing weight. I said, what you eaten yesterday? What time? She told 10 p.m. 10 p.m. if you eat, you will not lose your weight. What you eaten? She told me corn, sweet corn. When I asked why sweet corn, she thought it's a vegetable. It's not a vegetable, it's a carbohydrate. So there might be mistakes. So they have to send a morning breakfast, lunch, and evening. After 1 month, you will see the results are there. Then you can submit the report. It becomes your exam. Before versus later. The exam is your practical knowledge. You don't have to write 10 pages. And definitely how you are getting the clients, we are doing a lot of marketing. You have 20 people working in my marketing team, all are MBA. So they are creating a lot of campaigns in Instagram, in Facebook. We have a lot of followers in India, outside of India. If somebody is writing, I want to lose weight, or telling, I want to lose weight, and or mobile is listening everything. They all apps are listening. Google is listening, and they will send ads, and they click on it. And for that, you pay money to Google, Instagram, or Facebook. After that, these clients have been contacted and are given to a team member. There are three types of clients out there. Very rich clients, VIP clients, which we charge around 60, 70,000. It is handled by me or my senior members. Or there are middle class clients who are like corporate clients, like they are charged around 20,000. These clients are given to my members who are already have some experience. There are people who are not everybody is rich. Some people cannot pay. So we tell them our students will take care. These clients are given to you. They are also happy. You are also happy. You are getting an experience, and they are getting in results. And of course, when you give the diet plan to the clients, it is not that we are giving in 100% free, because if you give in free, nobody will take value, give the value. So we are giving with some money, like 4,000 or 5,000 they are paying. This money you can keep it. So let's say 2-3 clients in a week. After 3 months, you can earn also around 15,000. You can earn in a week, in a month 60,000. So it can be your extra income. But if you want to join my team, you could join after getting a certification, which is 3 to 6 months. Okay. So how the enrollment takes place? First of all, I hope today you have learned a lot of new things, starting from what is bullet LDL to insulin resistance, to how to reverse PCOD, diabetes, thyroid, what is GLP-1, fat burning hormones. A lot of new things you learn. I hope you enjoyed it. If you want to enroll, you learn everything. In every week there are classes, Saturdays and Sundays. Weekends have classes, and generally the Monday to Friday you are studying yourself, because you are also working. You have got some responsibilities. Okay, so that's why Monday to Friday you are studying yourself, and other days, Saturday, Sunday, you are coming to a class. But Monday to Friday you can ask me questions, because this group I am taking, so you don't have to worry. You have to ask me questions, and you will get an access to a learning center. What is the meaning of learning center? Learning center means that you are able to get all the study material which is stored in a cloud. You can study, and you can you can ask me questions if you have any question, and you have to come to a class with preparation. Okay. So generally, the courses are both basic courses are there and advanced courses. So we have to talk with me directly, so that I can give you an idea, what courses would be applicable for you, and definitely after 2-3 months you will start earning also. Okay. So I hope you have enjoyed the webinar. So if you want to come to the class, the next class will be on Saturday. Okay, Saturday, Sundays are the classes, and before that I'll give you a study material. So talk with me directly on WhatsApp. Okay. Afroz, I think also you have sent me a message on my WhatsApp. Yes, Afroz?
Yes, sir.
Why I didn't get it? You are Afroz. Okay. Why I'm not getting your number? Why just send me a message now. I think Ekta I've got it. Why Afroz I didn't get it? Okay. Your name I remember very well. Okay, you are also a biotech, and you have done some dietitian diploma. Yes, Afroz, you are also a biotech. You're from biotech background.
I'm from biochemistry background, sir.
But you already done some courses
Yes,
like this.
PhD
Yes,
diploma. Yes,
very
sir.
good. So now you are working as a biotech, or you are working as a dietitian?
As a dietitian, sir.
You are working in a hospital. Where you are working?
In the hospital.
Okay, so you can see that a lot of new things you have learned, which is not taught in MSc or not in PG. That's
Yes.
why a lot of doctors, dietitians are coming to do my courses, certification courses. Okay, so it will give you a lot of knowledge, lot of confidence. You'll be able to reverse diabetes, PCOD, thyroid, fatty liver. Every day you are getting it, and now you are giving calorie deficit diet, which will not give you which will not give you a good results. Okay, so knowledge will make sure that one diabetes diet plan if you are, I don't know, hospital, they don't pay you privately, but privately, if you are in my team, my students are earning per diet plan around 10,000, 20,000, diabetes diet plan. 10 clients, you are earning 1 lakh, which is much more than how much you earn in your hospital. Hospital also you can, work, and you can work parallelly as a private clients also. So everybody is doing like that. You can help a lot of people. The rich people will not go to hospital. They don't have time, remember. Okay. So what I will request you, talk with me after this webinar, and I will give the study materials and all guidelines how you can join. Okay. I hope you enjoyed the webinar. Ekta, also you talk with me. I think your knowledge is good. You can learn and you can earn also. Okay. So talk with me on my WhatsApp so that we can understand how you can join and you can come to the next class. And before you come to the next class, I'll give you some study material. Okay, Feroz,
Okay.
talk with me now so that
Okay, sir.
I can give you the study material. Okay, thank you very much. Thank you. Goodbye. I'm waiting.
Okay, sir. Thank
We'll
you,
talk
sir.
now. Okay.